is I'm going to go ahead and compare my MAR to my physician's orders. I'm going to make sure it's the right patient, right diagnosis, no known allergies. I'm going to go through, make sure all the medications are transcribed correctly. Okay, so that's good. So I'm going to go ahead and unlock my cart, place this safely. I'm going to lock my cart back. All right. Now what I'm going to do is I'm going to go ahead and go through my medications. I'm going to go ahead and look at the medications, make sure I understand why the patient's taking it, if it's a safe dose, any side effects I need to look for, any considerations I need to take, any interactions with each medication. Okay, so once I do that, I'm going to set these to the side. Throughout the skill, I'm going to be using the 6 rights, which is right drug, right documentation, right dose, right patient, right route, and right time. All right, so I have that. I'm gonna go ahead and do some hand hygiene. So I'm gonna wash my hands. I'm gonna go ahead and unlock my cart. And I'm going to grab my patient drawer. I'm gonna make sure it matches the right name, right date of birth. Okay. So we have this here. Go ahead and lock my cart back. All right, so this is gonna be my first check. So I'm gonna go down my list, okay? Get all the medications I need. This is the right name, correct dose, it's not expired. Okay, same for this one. It's not expired. It's the right medication. Okay, it's not expired, good date. We're good on that. Okay. That one's good. And then this one. Good date. Alright. Okay, so I have all my medications, so I'm going to go ahead and put these back. I'm going to unlock my cart. And we'll then lock my cart back. Okay, so I just did my first check, so I'm going to go ahead and do my second check, which here I would do any math that needs to be done. So, for this, good name, good date, I do not need to do math. Good name, good date, no math on this one. Okay, good name, good date, no math on this one. Alright, good date, good name, and I'm gonna have to do math on this one. Okay, good name, good date, and I will have to do math on this one as well, so I'm gonna do that real quick. Okay, so my math is complete. So I did all of that. All right. Okay, so that was my second check. So I'm gonna go ahead and do my third check, which is preparing the medications. All right, so I'm gonna go ahead and check it again. Right. I'm gonna get this. We only need one of these. I'm gonna put that in here. Okay, this is ready. All right, so I'm gonna go ahead and do my TB. TB, I'm gonna need 0.1 milliliter. So, go ahead. Clean that. I'm gonna let it air dry here. All right, so I have the right syringe. I'm gonna need 0.1. Okay, so it's dry. I'm gonna take this cap off. Gonna input it. Okay. Gonna do the one-handed scoop method. Okay, so this one's ready. I'm gonna go ahead and label this one. Okay. Next, I'm gonna go ahead and do my, get a Rolac here. Okay. Clean, circular motion, let it air dry. This one I'm going to need 0.5 milliliters. Okay. So it's dry. Okay, so there's that one. This one's ready. Alright, and then I'm going to do my heparin. Okay, so I'm going to clean. Alright. This one we're going to need 0.6. Okay, so it's dry, let it air dry. And push the air in, we're gonna invert it. Okay, now with heparin, it is a high alert medication. So I'm going to have a second nurse come and check my medication. Okay, so I had my nurse check it, so we're all good. Alright, so all my medications are ready. I'm going to go ahead and put these back in my patient drawer. I'm going to unlock my cart. Okay, I was preparing the medications. I was checking the correct dose. It's not expired, everything's good. All my labels are on. I'm gonna label my heparin real quick. Okay. I'm gonna go ahead and clean that. Take my more with me. Everything's good. Alright, the cart is going to be locked. I have my keys, I'm gonna put them in my pocket. Alright. So we're gonna go ahead, we're gonna go to the patient's room with medication and then more. So I'm gonna come in, I'm gonna knock on the door. Hi, I'm Chelsea, I'm gonna be your nurse today. I'm gonna be giving some medications. Can I have your name and date of birth? Okay, so they tell me my name and date of birth, so I'm gonna check. And it matches. At this time, I would do any blood pressures or any pulse checks that I need to do before applying medications. I'm gonna go ahead and provide for some privacy here. Alright, so I'm gonna go ahead and wash my hands. I'm gonna go ahead and get some gloves on. Alright. So the patient's already sitting up, but if she was not, I'm gonna raise the head of the bed. Okay, I'm gonna make sure you don't have any allergies. She has none. She's okay. She's comfortable. So I'm gonna go ahead and raise the bed up. For good body mechanics. All right. So the first thing we're gonna do is we're gonna go ahead and give your oral medication. I would have a glass of water here with me as well. So I have the oral medication. She can assist me if need be. So I'm gonna give her that. She's gonna take a drink of water, and I'm gonna stay, make sure while she swallows it. Okay, so it's swallowed, so that one's good. All right, I'm gonna go ahead and get my washcloth here. We're going to wash the site. Then I'm gonna grab another wash rag, and I'm going to dry it. Okay. All right. So I'm gonna go ahead. Get my ointment on here. I'm gonna rub it on. Okay. So the ointment's finished. I'm gonna go ahead and take my gloves off here. I'm gonna perform some hand hygiene. I'm gonna make sure she's okay. Doesn't have any questions as I'm going. Okay. Alright, so we're gonna go ahead and start with our injections here. Okay. So the first one we're gonna do, we're gonna go ahead and get our TB skin test out of the way. I'm gonna ask if she's ever had a TB skin test. She says yes. I'm gonna ask if she has any problems. She says no. Okay. So we're gonna go ahead and cleanse the site. Okay. I'm gonna cleanse in a circular motion. I'm gonna let that air dry here. Alright, I'm also going to make sure she knows that she needs to get this read in 42 to 78 hours. Or 48 to 72, sorry. Okay. So it is dry. We're going to go ahead. I'm going to go in at a 5 to 15 degree angle here. Barely go in. We're going to inject. Watch for a little whelp there. Okay, we're gonna pull out fast, dab around it. We're gonna put this in my shorts. Okay, you don't wanna put a bandage or too much pressure on this one because it can mess up the results. Okay, so the TB skin test is done. So we're gonna go ahead and do our cannula here. We're gonna do the posterior arm. So we're gonna do palm, palm. We're gonna go right in here. Okay. So we're going to cleanse that area. Alright. Okay, so the site is dry. I just cleaned that. Okay. We have our heparin here. Okay. So this one we can go in at a 45 degree angle. Sometimes you can go to 90 depending on the size. I'm gonna go in, we're gonna inject, and then pull out, apply pressure. Sharps. You can put a bandage on if needed. So that was good. Okay, now we're gonna do our parallel and the ventroclevial here. Alright. So, I'm gonna go ahead. Press the side. Okay. Before that, I'm gonna show you how to find it. So I'm gonna walk up. I'm gonna find the sorry. I'm gonna palm that right here. Your thumb is gonna go toward your finger. You're gonna feel the bone up here, and you're gonna go right below it. Okay. So we're gonna clean that. Okay. Now for intramuscular, you're always going to go in at a 90 degree angle here. So we're going to go in, inject, pull out, apply pressure. This goes in your sharps. You can also put a bandage on if needed on that one. Okay, so that one's good. Alright, so I'm going to go ahead, take my gloves off, make sure my patient is doing okay, ask how she's doing. I'm going to wash my hands. I'm going to go ahead and clean out my area here. Alright, I'm going to go ahead and make sure she's okay. I'm going to ask if she wants to stay sitting up. She says yes. Alright. So I'm going to lower the bed, make sure she has her call light. I'm going to tell her I'll be back to check on her in about 30 minutes to see how she's doing with the medications. And then I'm going to go document on my MAR what time I give the medication, what route, and what medication I have given to the patient. And I'm going to leave the room.